welcome back to Sparkle with Sophie. On today's video we're going to be looking at acne and my acne journey. So I've got some little notes over here just so I don't miss out anything, but I'm just going to give you some details of what I went through and what I dealt with, just some advice for people who have acne and for those people who are friends and family of somebody on Roaccutane. So, my acne journey. As you can see right now, I'm wearing no makeup, nothing at all, nothing on my face. Yes, because I think it's important if I'm going to sit and do this video and talk about acne, then I need to have the confidence to show you what I look like without any coverage and any makeup on. So here we are, fresh out of the bath, and then I just did some little curls in my hair. So my acne journey, I really didn't get spots at all. Hardly ever, maybe a few blackheads up on my nose, maybe the odd one on my chin as a teenager. But I didn't have any acne or any bad spots until I hit about 18. Yeah, about 18 and a half. I started at dance school, and I want to say within a week, I started breaking out in cystic acne. Very, very bad. It all started all across my chin, and then just above my lips. And everybody says, you know, it's hormones, it's hormones. So I went to the doctors. And I spoke to them about it, and I said, you know, I can't have this happening to my skin all the time. I've just started at dance school. Image and the way you look is obviously very, very important in the performing arts industry. So over the course of 3 years, from the age of 18 to 21, being at dance school and performing arts college, the doctors gave me Duac and Differin, which are 2 creams, and like acidy creams that are meant to clear up your face. Didn't work. They then put me on 5 different types of contraception because they thought the mini pill would try and balance out my, the pill I was on, they'd try and balance out my hormones. Didn't work. So they put me on the mini pill, microgynon, Dianet, Yasmin and the implant, all of which massively alter the hormones in your body. You know, they've got progesterone in it and they have estrogen, they have all different things in them that can really affect your body, can really affect you mentally, and obviously they mess up your whole, they can really alter your cycle as a woman to some extent, stop you getting periods completely, to some others make you bleed erratically. Yeah, so they can have lots of different effects on your body. And so I went through all of that and absolutely did not clear my skin. So I had acne all across the lower part of my face, I had over my chest and my back. And it was just completely consuming my life. It completely and totally affected me at college, affected me socially, physically, everything completely affected my life. And then when I was 21, I was very fortunate. I auditioned for Disney Cruise Line and I got the job, which was lovely. And then I was due to start that in January, and at this point in October, my face was at its complete worst. You know, just shows you the power of makeup, because I'd completely covered everything when I went for the audition. So I, after having a complete breakdown about it, because, you know, I'll explain that further in the video, I then went to Harley Street to the SKN clinic and I was prescribed Roaccutane, or if you're in America you call it Accutane. So I was prescribed that and I was on 60 or 70 milligrams, I can't quite remember which. And I was on that for about a period of 5 months, because the amount you take depends on your size, your weight and everything, and I'm only 5'1" and I'm only a little person, so I didn't have to take that much. So I did it over a course of 5 months and it cleared it all up. It really, really cleared it all up. It was absolutely incredible. Would I do it again? Yep. Are the side effects hideous? Absolutely. So if you're about to go on this product, just a bit of insight for you. If you go on Roaccutane, you have to have a blood test, you have to have a pregnancy test, and you have a checkup once a month to get the new prescription, because it is a very, very serious drug. You can get physical side effects such as migraines, nosebleeds. Also, emotionally, it can lead to suicidal thoughts. I remember feeling very, very depressed, very emotional, very, very, very unhappy and in a dark place. But in contrast to that, 3 years with having acne, I was very unhappy a lot of the time anyway. So for me, being on Roaccutane, I was like, well, at least it's worth it because it's going to clear up for me. So that is my journey, what I went through. So I'm going to give you a little insight as to what I think, other experiences I had to help you people who have acne. So, the effects that it has on your mental health and your behaviour, having acne. Yes, I remember completely and totally isolating myself from social gatherings for most of first year at uni. So I wouldn't go out with the girls really, I wouldn't go partying ever, I wouldn't go and do fun things because I just wanted to sit in my room and hide my face because it was horrible all the time. And I remember that being very upsetting, but it was better to just be by myself with all these cysts and boils on my body than it would be to go out. You know, I didn't want to dress in any nice clothes because I didn't want people to see my chest or my back. I didn't want people to see me because I felt so ugly all the time. I've just got my little notes here because I want to make sure I don't miss out anything. I also didn't help myself, which is something you girls and guys really need to bear in mind. When you are suffering with acne, telling yourself that you are ugly all the time does not help you. Okay, I used to sit in front of the mirror and I used to tell myself, God, you're so ugly. God, your face is so disgusting. This is so awful. I'd be caking makeup, like 2 layers of thick foundation to just try and even out the skin tone. And because I'm very pale, obviously anything red, you could really see it on my face. I would really try and cover it all. And that just doesn't help you. Doing that all the time, telling yourself you're ugly, it puts you in a worse place. So then the products that I now use, I started using after Accutane. I use the La Roche-Posay Effacé Cloud Duo, which is brilliant for the individual spots. I put it on like the little one on my chin, I have a little one here. I would put it on there and it can really burn the skin, so you just want it directly on those spots. I also use the whole pH formula range from Cosmetics Doctor. Her name is Dr. Amber and I'll put the link in the bio. Absolutely brilliant. It's prescription level. She's absolutely excellent, so I still carry on using that. And then in terms of foundation for things, I just use NARS because it's non-comedogenic and I feel like it doesn't clog my pores, so it's not as heavy. Okay, advice for your family and friends. So if your loved one, your friends, a member of your family, somebody you're close to, a co-worker, a colleague, whatever, whoever who is involved in your life is suffering with acne, it is something to be mindful of, yes, when it comes to what you're going to say about their appearance, when it comes to making comments. I remember seeing pictures of myself and the first thing I do when you say, oh yeah, can I see? I would look at it and all that I'd think was, God, Sophie, your skin looks disgusting, you look horrible. So it would make it even worse when people come up to you and they want to tell you, firstly, how you can fix it, okay? Because if you're not a doctor and you're not a dermatologist, you do not know how to fix acne correctly, yes? Anybody who doesn't understand that, going to say it one more time, you don't know, yeah? Because I had people tell me, it's because you wear too much makeup, you need silk pillowcases, it's because of your hormones, it's because you eat meat, it's because you eat dairy, it's because you don't have enough fruit and veg, it's because you're stressed. Yes, so I would remove these things or change things, and guess what? Skin didn't get any better. It didn't get any better at all. So unless you are a doctor and dermatologist, do not give advice to those people unless you are going to say, you know what, if it's really bothering you, if they confide in you, you offer support to go and take them to a clinic. Unless you're going to do that, you're not in a position to comment. Yeah, just an idea. Sort of things like negative comments about, oh, your skin looks really sore, why is your face like that? You wouldn't go and say that to somebody who had a big bald patch in their hair from alopecia. Yeah, it's the same thing. It's an insecurity that somebody else has. You shouldn't be talking about it. You should be very mindful of it. Yeah. Staring as well. Try not to stare at the area. That's very, very important when you're talking to someone and they're looking here. And you're like, they're looking at my skin. Oh, please stop it. Yeah, so bear that in mind too. And look after your friend. The main thing in this situation is understanding that it is a physical and a mental issue that can really, some people it doesn't really impact on them. Some people, such as myself, and I know a lot of others, especially I found who are in the performing arts industry, it can really, really affect you because it does have that knock-on effect when you need to perform in front of people, when you need to stand and sing and be vulnerable like that in front of people and you don't feel comfortable or confident in yourself. So if that person confides in you, you just need to be supportive. You know, show them love, show them compassion. It is something that they are dealing with, and there is no quick fix for it. You know, Roaccutane took me 5 months, and that was the quick fix. So it's really important that you bear that in mind when you're dealing with acne. Also, parents, guardians, grown-ups, if it's somebody who's a teenager and they're dealing with it and it's really affecting them, go ahead and help them and get that sorted. Yes, a consultation at places like SKN is £20, and you can become better educated on what acne is. You can become better educated on what you can do to help if there are things that need to be changed perhaps. You can have blood tests done to, you know, see if there's a food intolerance there, if there is an imbalance, because for some people it might be dairy, it might be gluten, it might be one of those things. So it is important to get involved and find out, because it is something that can affect them socially, emotionally, and also affect their education and whatever they're doing at the time, because it can be like a huge weight that there's just nothing you can do about. So it's really important to grown-ups, parents, take that note and help whoever it is who's dealing with that. And to anybody else who's had acne or who has acne at the minute, I know it is one of the most horrible things, something that really, really affected me hard. It is such an awful thing, but the worst thing about it is looking back and reflecting on it and thinking about how I let it control and ruin 3 years of my life. Yeah, I mean, I'm not going to stand and say I had a horrible 3 years at uni, but it was something that was constantly in the back of my mind. Anytime I was proud of myself for doing something, I'd look in the mirror and go, oh, but you look so awful. Always, always. Something that my skin was always sore. But sometimes you have to go, you know, it is what it is. And yes, you want to get it changed and you do want to get it fixed, but don't let it be a burden and ruin everything else that you're doing. Because you can't get time back. You can't get those 3 years back. And even though there might be some really crappy people out there who want to constantly remind you of what your face looks like, or your chest or your back, you could be even worse, and you could have a horrible personality like them and think it's okay to say that to people. So, you don't. So don't worry about that. But yeah, if you are troubled with acne, it's definitely worth spending that £20 for a consultation. If you are a professional and you have money and you can afford it, get on the medication that professionals advise. I think personally, it's really good to go and use that, really good to get it fixed. It will really, really change your life. It really, really did with mine. But yeah, that's all I really have to say about the video. I felt like I had something else to say and I don't. It's gone out of my brain. But that's all of my acne journey. That's some advice that I think I can give to you about it. So even though it's not really as upbeat as most of my videos, I like to keep it very real on my channel. I like you to see exactly how it is. And yeah, if you have acne, definitely don't let it ruin your life. Don't let it consume you. So, thank you for watching my video. I hope this helps anybody out there who is suffering with acne or is trying to support somebody who is suffering with a skin disease or disorder, whether it's acne or something else. And I'll catch you next time on Sparkle with Sophie.